Hello. Today I need to talk to you about HIV/AIDS, and the pharmaceutical companies. To begin with, we need to discuss the difference between HIV and AIDS. So HIV is a virus that attacks a type of white blood cell called a CD4 cell in the body's immune system, and this is from medicalnewstoday.com. AIDS is a syndrome or range of symptoms that may develop in time in a person with HIV who does not receive treatment. So you can have HIV without AIDS, but cannot have AIDS without HIV. So AIDS is also called stage 3 HIV. You get AIDS when your detectable viral load reaches a certain point and your CD4 cell count reaches it's less than 200, I believe. So stage 1 HIV, the symptoms are basically the flu. If you have symptoms, a lot of people don't. So this includes fever, chills, fatigue, night sweats, muscle aches, sore throat, mouth ulcers, swollen lymph nodes. Stage 2 is similar symptoms. Many also still have no symptoms, and this stage can last between 10 and 15 years if you have medication and all of this. Stage 3, which is AIDS, is rapid weight loss, recurring fever and night sweats, prolonged swelling of lymph nodes, diarrhea that lasts more than a week, sores in your mouth and all of this, pneumonia, depression, and other neurological disorders like memory loss, blotches, and this is what kills you, not HIV. AIDS actually brings your immune system to a point where you can get they're called opportunistic illnesses, and those are generally what kills you and not actually AIDS. So the transmission, you can get it from blood, sexual fluids, and breast milk. You have to have a detectable viral load, and having a detectable viral load can be prevented through ART treatments. You take medications, and it lowers the viral count in your blood, and it reduces the chance of it being transmitted. So sex, sharing of fluids, sharing needles, birth and breastfeeding have a chance of transmitting it. Overall, it must enter the bloodstream in some way. So it is not transmitted through air, water, closed mouth kissing. Open mouth kissing can transmit it if there's a mouth sore or some form of blood in the saliva. Holding or shaking hands, sexual activities where fluids aren't shared, sharing dishes, utensils, and glassware also doesn't transmit it, and insects like mosquitoes who drink blood actually do not transmit HIV. This is a myth. The treatments are ART treatments, which are antiretroviral therapies. So there are 5 classes of these treatments. You get 2 medications from one class and then typically one of another. There's non-nucleoside reverse transcriptase inhibitors, NNRTIs, nucleoside or nucleotide reverse transcript inhibitors, NRTIs, protease inhibitors, integrase inhibitors, and entry or fusion inhibitors. So again, you would get 2 medications from one of those classes and then one of another if deemed necessary. There are a total of 31 medications according to healthline.com. There's probably more that just weren't listed. Of the 31 listed, 10 had generics available, and the cheapest generic range was $10 to $45. The non-generic actually ranges up to $4,303, and the majority were between $1,500 and $3,500, and that was for a 30 to 60 pill count. So you would get a month to 2 months worth of pills, and it would cost up to $4,303. Sometimes people get prescribed drug cocktails, so they would get 3 pills that would do the same thing as one generic or one name brand pill, and this can actually prove ineffective if somebody is resistant to one of the drugs, there are pharmacy discounts for these drugs, or there can be. There's programs to help reduce the financial load of HIV and AIDS. Insurance does cover most of the drugs, but it also depends on what insurance plan you have and what drug it is. So if a drug is considered a specialty drug, then the copayment will actually be far more than any other drug. So again, insurance costs money. Most people have to pay for their insurance. I mean, I think everybody has to pay for their insurance. I don't know. I don't pay for my insurance. But insurance is costly. Not all pharmacies have discounts for all drugs, and programs often can't provide enough money because they have an overload of people who need it, or there is a wait list or something that restricts the ability to give money to those who need it. So why does this all matter? Specifically the U.S. pharmaceutical companies largely inflate the cost of HIV/AIDS treatments, as they do with many other treatments like insulin, to increase their profitability while ignoring the hardships that patients and their families experience as a result. So in 2015, Turing Pharmaceuticals bought the rights to a generic drug for an infection that can cause severe symptoms in someone with HIV or hepatitis C, and increased the price by 5,500% to the point where it was about $750 a pill. And this isn't unheard of. It's not the first time this has happened. But the reason it caused such an uproar at the time was the CEO blatantly said that he didn't care about the hardships other people experienced, or he didn't see the problem with increasing the price this much. They bought the rights to the drug, so nobody else could provide the drug. That company was the sole provider. You couldn't find another generic because they already bought the generic. And the reason this can happen is because there's no federal price control for pharmaceuticals. There's no price cap, and the only thing that will bring prices down are if another company produces the drug at a lower price. So if the company like Turing did bought the rights to the whole drug, then nobody else can make the drug, so there's no competition, so the drug can remain at an increased price. They did end up reducing the price after the uproar that happened, but if nobody had acknowledged it, it could have increased more if they decided that was what they wanted to do. Companies actually tend to hide their research and production costs so that the public can't say a drug is unfairly overpriced. So if the company produces a new drug, it isn't produced through another company at all. It's the first time it's been produced. If they produce a drug and they price it at, say, $800 a pill, they could say that the research that was put into producing that drug and the production costs for producing that drug cost so much that it's fairly priced so that they can get their money back. But because they also hide the research and the production costs, we as a public can't tell if they're truthful in this or if they're just saying that because they want more money. Gilead Pharmaceuticals released their 2018 final quarter and full year financial results, and from HIV products alone, their sales were $14.6 billion for the full year and $4.1 billion for the final quarter. In total, the product sales brought in $21.7 billion. Their cost of goods sold and operating expenses for 2018 were $16.98 billion, leaving a total revenue of $4.72 billion. So after taking out their employee wages, cost of productions, any other operating expense, so shipping, all of this, after taking all of that out, they still have $4.7 billion just from sales. And this wouldn't be an issue because it's a company if people were able to afford the drugs. In 2013, Leonardo Montplet, who was 35 at the time, was interviewed and told about how, and he told the interviewer about how he has had to cancel appointments and procedures because he couldn't afford them, and he said that he had to push aside dealing with the issues that were not immediately life-threatening. He said that even with his partner's life insurance, the co-pays were financially straining, and he was drowning from medical bills. So even he talked about how initially he was on a low-paying job that didn't have life insurance, and so he was paying for his own life insurance. And then he was getting help from a LA HIV help aid. I can't remember what it was, and then his partner added him onto his health insurance, which had more benefits but cost far more. And even with the insurance, the co-pays, so the insurance pays for a drug and then you have to pay a co-pay so that they can slowly make the money back. The co-pays were incredibly high at the time for the drugs that he needed. And then in 2018, Kimberly Glanz wrote a blog about her story, and she told about how she lost many jobs because she was both taking care of her partner who had AIDS, and then later she was experiencing many health side effects because of medication. She had to change medications, and she was experiencing health side effects from those medications. And because she was having a hard time doing her job because she was dealing with the side effects, she got fired. And both of these cases they aren't standalone cases. It's really common to hear about people with long-term illnesses, cancer, diabetes, with the insulin. It's really common to hear about them talking about how they can't afford their medication, they can't afford treatments, they can't afford the things that they need because they either can't work or they can work and they just don't get paid enough. And that shouldn't be an issue. There shouldn't be this, you have to choose between a procedure that will save your life or getting one, or you shouldn't have to choose between getting two procedures, one that will save your life and one that will make it incredibly easier, or only getting the one saving your life. It shouldn't have to be an either-or situation. The medical the medical industry and the medication industry shouldn't cost so much that people financially can't afford it. It shouldn't. It's incredibly classist, and we need to acknowledge it, and the pharmaceutical companies need to acknowledge that what they're doing is inherently wrong. And, I mean, people shouldn't have to die because they can't pay for their things. Like, shouldn't have to die because they can't pay for medication, you know? That was a train wreck, but we're thriving.